Okay. Hello, everyone. My name is Alan Shu. I'm a psychiatrist at the Morse Cancer Center, and I'll be talking today about living and coping with prostate cancer. So this is the outline of my talk. I'm going to talk about challenges after prostate cancer diagnosis, ways of coping with symptoms. I'll talk a little bit about this subject, reconnecting with sources of meaning. It'll make a little more sense once I get to it. And then when and how to seek professional help. So some of the challenges after a diagnosis. So first, the reaction to the diagnosis. Everybody reacts differently. There's not really one right way to react, but there's a lot of different emotions people might have and different behaviors. There's different ways of coping. There's different physical and psychiatric or emotional symptoms that can come about after due to the prostate cancer itself or due to different treatments for prostate cancer. Sometimes when people are diagnosed with prostate cancer or any cancer or experience progression or facing a limited life expectancy, they can experience a loss of a sense of meaning, which can be a very difficult experience. And then sexual dysfunction, incontinence, those are also things that can happen that can be challenging. And there's different ways to cope with that and approach that that can affect your experience of living. So in terms of ways of reacting, there's not one right way to react. It's helpful sometimes to think about a reaction to a cancer diagnosis in terms of grief. And just like everybody grieves differently, everybody reacts to a cancer diagnosis differently. And it's a range of emotions, it's a mix of emotions. People may experience anger, they may feel anxiety or fear, sadness, shock, guilt, a sense of denial. Those are all common reactions, and they all serve a purpose. So all of these emotions that we can have in response to any type of bad news or obstacle, they are normal reactions and they serve a purpose. So for example, anger, it's an emotion that we have when we want to fight. It can be very motivating for somebody to feel angry. They want to change their situation. When somebody feels anxious, that tends to make them focus on the thing that's making them anxious. And so to try to do something about that. Sadness, people can feel sadness in a time of loss, and it can help connect you with others who kind of share in that sadness. And so all of these kind of emotions, they're normal emotions, they're normal reactions. And so often it's helpful to think not in terms of which one is the right way to react, but what purpose is it serving? Is it serving a purpose? Is it helping somebody be able to move toward the things, doing the things that they need to do? Whether that's treatment or whether that's finding the things that they value in life and doing those things and focusing on those things. Now, everybody, usually people cope in the ways that they normally cope with challenges. And so somebody who's prone to becoming angry when encountering an obstacle, more likely than not is going to become angry if they are diagnosed with cancer. And so sometimes it's helpful to think about, well, how did I react to other challenges, obstacles I faced in my life, and how did I get through that? What did I do to get through that? So there are different types of coping. There's a lot of ways people cope with challenging emotions, challenging situations. Sometimes it's helpful to think about whether that form of coping is adaptive or if it's maladaptive. So an adaptive coping mechanism is anything that helps them deal with that challenge so that they can be able to live their life in the way that they need to or want to. So some people, when they're diagnosed, they educate themselves. They go online or they they talk to doctors, they talk to loved ones who maybe have some expertise or friends, and they find out all they can about their new diagnosis, what treatments are available, and that's how they kind of feel a sense of mastery or control. Some people reach out for support. Some people kind of re-engage in the things that are most important to them. Maybe they reprioritize their life. And sometimes, they may reach out to professionals. Now, maladaptive coping, these are things that kind of take us off the path of our values. So increasing amounts of alcohol or substance use, strong avoidance or denial, so not going to appointments, avoiding treatments in order to not have to think about things. And also sometimes people take some kind of adaptive coping skill or mechanism and take it to an extreme. So taking the educating oneself example, while it can be very helpful to educate yourself, if you're spending 5-6 hours a day, every single day online, looking at every website, agonizing over every possible decision you might have to make, not talking to people or avoiding activities, just staying home all day, then that's kind of, you've taken that adaptive coping mechanism and taken it to the maladaptive extreme. Now, so one thing I wanted to talk about a little bit more specific, because I get this question a lot, is how do you deal with denial? Often this question comes from loved ones who, and sometimes oncologists or other physicians, when they feel like the person that has cancer is not, quote unquote, facing facts or acknowledging the reality of their situation, the full reality of their situation. And again, it's helpful to think about what purpose is the denial serving. So not all denial is bad. Sometimes a little bit of denial helps somebody get through that initial shock or that initial difficulty in changing their identity around having cancer now. So for example, I have a couple examples here. And what they have in common is, okay, well, this is something that is changing their life. And maybe the specifics in what they're talking about aren't taking into account what their new diagnosis or prognosis is. But what they're trying to do is continue living their life. As long as they say they're still seeing their doctors, they're still taking the treatment recommendations, talking it over, and making decisions, then letting them have that, okay, making plans that maybe are not realistic. Sometimes that can be helpful for them just to reorganize their life. And then as time goes on, they start to integrate that information in. And so as a loved one or physician dealing with somebody, when they have what we think of as maladaptive denial, where they say, I don't have this cancer, it's not true, I don't need treatment, I'm just going to do X, where X is some type of way of treating or dealing with their cancer that doesn't have to do with evidence-based treatments. It often is not helpful to be very confrontational, because that person, why are they in this type of denial? They're very afraid. And so if you just keep confronting them with the thing they're very afraid of, they're going to embrace that denial even more strongly, and it's going to be a very frustrating experience. So that situation, it can be helpful to kind of sidestep the denial and look at, well, what is important to you? Why are you making this decision? And how can we be on the same page in supporting what your values are? So if you can get the person talking about, say, something they want to do in a year, like some kind of milestone, you can say, okay, well, how is your decision? What would be the downside of seeing the doctor if your goal is to attend this celebration next year, and we can just listen to what the doctor says. And the change may be gradual. It's hard to expect the person to immediately switch over to deciding, yes, I want to do everything you're recommending now, but you can kind of help them through these different steps. So you can see this is stages of change. It's a concept that we use often in treating substance use disorders, alcohol use disorders, where people can be in different stages of change. There's a technique called motivational interviewing. Apologize for my dog. And so this is something that can be helpful in thinking about where this person is in terms of how ready they are with moving forward with the desired change. So next I'm going to talk about different ways of coping with symptoms. There are a lot of ways of coping with symptoms, and I'll touch on these different techniques later. I won't go through every single thing, but what I want to do is give you something that you can learn now as you view this presentation in practice while I'm giving this presentation. These are things that you can use every single day. They're very quick exercises. So the first one is progressive muscle relaxation. And the concept behind this is, so taking anxiety as an example, when people feel anxious, their brain generates that anxiety in their anxiety circuits. It sends a signal to their body to have different physiological changes. For example, tensing up your muscles, maybe your breathing accelerates and you do a lot of chest breathing as opposed to abdominal breathing. Your heart rate might speed up. You might get restless and move around a lot. And so these are the signals of anxiety that your brain is telling your body to do. And then what actually happens, which is not as, widely understood, is our brains actually take feedback from our bodies to help our brain determine whether it should feel anxious or not. So if it's sensing that your muscles are tight or that you're restless and tapping your feet, or you're breathing really rapidly, it's sending a signal to your brain, there's something going on, you have to be anxious about it. And what happens is the signal goes down, the signal goes up, and it kind of amplifies over time. And so progressive muscle relaxation is a way to try to help break that cycle by focusing on what you can change in your body so that your brain can kind of tone itself down a little bit. So I'm going to go through, I'm going to play a video. It's going to walk you through the exercise. And the idea behind it is you're trying to monitor and be aware of how tense your body is and actively relax it. And you're going to go from your feet all the way up to your head. Breathing in a certain way is helpful. So taking breaths with your abdomen. So if you ever watch a baby breathe, you notice their stomach comes out. So it's helpful sometimes when you're learning how to breathe to put a hand on your stomach. And as you take a breath in, your abdomen should push out your hand rather than breathing where your chest is rising. So I'll play this video. It's about 6 minutes and 30 seconds.
Progressive muscle relaxation is an exercise that reduces stress and anxiety in your body by having you slowly tense and then relax each muscle. This exercise can provide an immediate feeling of relaxation, but it's best to practice frequently. With experience, you will become more aware of when you are experiencing tension, and you will have the skills to help you relax. During this exercise, each muscle should be tensed, but not to the point of strength. If you have any injuries or pain, you can skip the affected area. Pay special attention to the feeling of releasing tension in each muscle and the resulting feeling of relaxation. Let's begin. Sit back or lie down in a comfortable position. Shut your eyes if you're comfortable doing so. Begin by taking a deep breath and noticing the feeling of air filling your lungs. Hold your breath for a few seconds. Release the breath slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Even slower now, take another breath. Fill your lungs and hold the air. Slowly release the breath and imagine the feeling of tension leaving your body. Continue breathing slowly throughout this exercise. Try to focus on the feeling of air filling and leaving your lungs. It will be normal for your mind to wander. When it does, do your best to bring it back to the moment. Now, move your attention to your feet. Begin to tense your feet by curling your toes in the arch of your foot. Hold on to the tension and notice what it feels like. Release the tension in your foot. Notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to the feeling of tension. Release the tension from your lower legs. Again, notice the feeling of relaxation. Remember to continue taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. And release. Feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking your stomach in. Squeeze harder and hold the tension. Release the tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Continue taking deep breaths. Breathe in slowly, noticing the air fill your lungs, and hold it. Release the air slowly. Feel it leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can without straining, and keep holding. Release the tension from your back. Feel the tension slowly leaving your body, and the new feeling of relaxation taking its place. Notice how different your body feels when you allow it to relax. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm. Hold it. Release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, hands, arms, and shoulders. Notice how your arms feel limp and at ease. Move up to your neck and your head. Tense your face and your neck by distorting the muscles around your eyes and mouth. Release the tension. Again, notice the new feeling of relaxation. Finally, tense your entire body. Your feet, legs, stomach, chest, arms, head, and neck. Tense harder without straining. Hold on to the tension. Now release. Allow your whole body to go limp. Pay attention to the feeling of relaxation and how different it is from the feeling of tension. Continue taking deep breaths. Begin to wake your body up by slowly moving your muscles. Adjust your arms and legs. Stretch your muscles and open your eyes when you're ready. You've completed the progressive muscle relaxation exercise. Repeat this exercise daily to experience the ongoing benefits of relaxation.
So the next exercise, so this one has to do with thoughts. So we have one technique for kind of your body, and then another one for your thoughts. There's different ways of addressing worries or anxiety. There's some psychotherapies or talk therapies that focus on trying to help you change the type of thoughts you have. So if you have certain worries, challenging those worries and replacing them with something less anxiety provoking. That form of psychotherapy is called cognitive behavioral therapy. So cognitive diffusion, it's a different type of technique. It comes from a type of therapy called acceptance and commitment therapy. And the idea behind it is when we have a lot of worries, it's tempting to try to get to really engage with each worry. But then what happens when you're engaging with your worries is it's like you're arguing with yourself. You're trying to convince yourself not to feel worried about something. And then you actually can get even more worked up about it. And that the feeling, it's when we feel fused with those distressing thoughts. And so this technique is to help defuse yourself from those kind of thoughts. It helps us realize we don't have to experience the anxiety that the worries are meant to generate. We can just have the thought, but not engage with it.
Exercise 3. Leaves on a stream. The idea behind this exercise is to simply notice your thoughts coming and going without getting caught with them, without getting into a conversation with them, not trying to control them, not getting tangled up with them, just noticing them and then letting them go. When you are ready, begin. Sit comfortably in your chair with your feet on the ground if you can and your back straight, but not too straight, sitting against the chair. If you wish, close your eyes or have a heavy-lidded gaze, maybe looking at one spot on the ground. Now imagine you are sitting on the bank of a stream and that there are leaves flowing past. The stream and the leaves can look any way you like to imagine. Notice a thought that comes into your mind and imagine placing it on a leaf and letting it flow on. Notice each thought. Imagine placing it on a leaf and let it float on. If your mind begins to wander, just notice that. And return your focus to noticing the thoughts that come to mind. And imagine putting them on a leaf and let them float on. If your thoughts stop, just imagine watching the stream until the next one comes along. It doesn't matter if they are good or bad thoughts. Just notice them and imagine placing them on a leaf and let them float away. If they hang around, just notice that. Don't force the speed that they float away on. Sometimes the leaves that pass are ones that might grab our attention for some reason. Sitting on the bankside, we could notice that attention-grabbing leaf. Let it go and watch and wait for the next leaf that comes along. The aim of the skill is to simply notice that our thoughts are like leaves on a stream, always moving on. Sometimes we think a little or we think a lot. Sometimes we get stuck on thoughts that grab our attention. But all our thoughts come and go, even worry thoughts or sad thoughts. Spending a few more moments just watching your thoughts and placing them on a leaf and letting them go. And when you're ready, begin to open your eyes and bring yourself back into the room. What was it like to watch your thoughts go by? What did you notice?
So some people like more thought-based ways of coping with anxiety. Some people like more the kind of physical ways. Both are effective. Some are more effective for some people than others. What I would encourage you to do is if you, even go on YouTube and look at relaxation techniques, you'll find a lot of different ways. There's different breathing techniques. There's different mindfulness or meditative exercises, guided imagery. And these are skills which work best if you develop the skill, and then because if you try to use the skill, let's say you're having an anxiety attack or panic attack and you're trying to do something like this for the first time or one of the first times you've ever done it, it's going to be very difficult. But if it's a skill that you develop, it's going to just be a new thing in your tool belt that you can pull out when you need it. So these next few slides, these are basically a summary of what's been studied for different symptoms as ways to manage these symptoms without medications. So these are symptoms that are common to people who have prostate cancer or are getting treatments for prostate cancer, whether that's androgen deprivation therapy, chemotherapies, radiation. And so often I get the question, well, how can you can't think your way into not having this symptom? And it's not so much that you're trying to get rid of the symptom. The idea is what you're trying to do is keep the symptom from interfering with your life as much as it has been. So, having these techniques is not going to mean you won't have fatigue or you won't have nausea or vomiting, but using these techniques, you can live your life despite having fatigue and having nausea or vomiting. So fatigue, self-monitoring, all that means is keeping track of when you have fatigue most and when you have it least. And so this might correlate with when you get chemo and the time in between your sessions. It might be certain times of the day, it might be certain days of the week. But if you keep a journal and you just record, like for each day for a few weeks, Monday, energy level 3 out of 10 in the morning, 5 out of 10 around lunchtime, and 7 out of 10 in the evening. That way you can kind of start seeing a pattern over the course of several days. And then that allows you to use some of these other techniques, so energy conservation, saving up and scheduling activities during peak energy, saving up those most important activities for the times that you generally have the most energy. And so you still will have the periods of low energy, but they'll interfere with your life less. A lot of us are used to multitasking, doing a lot of things at once, but when you have fatigue, that becomes much more difficult. And so something you can do is try to figure out, prioritize what's the most important activity you want to get done for a given day or for a given week, and have that be, the thing that you put in that most important peak energy period. Naps, this note is about, so when you take a nap that lasts an hour, 2 hours, you're actually sleeping. And then if you wake up, you're going to be interrupting a sleep cycle. You're probably going to wake up pretty groggy. And then because you've had some sleep, you started a sleep cycle, it pushes back your evening sleep. So it's more difficult for you to fall asleep at night. So if you take naps, try to limit them to 30 minutes or less. You can take more than one in a day, but try not to get into an actual sleep phase. Nausea and vomiting, some of these things, so progressive muscle relaxation has been looked at for nausea following chemo. Something that is relatively common is something anticipatory nausea and vomiting. So when you know you're going to become very nauseous after a session of chemotherapy, you start becoming nauseous the night before. And it has to do with anxiety and that you're associating certain cues with the nausea, and so you're actually generating that nausea. Distraction is often helpful. So if you know you have anticipatory nausea and vomiting, so the day before it, work with your family, schedule something that's going to occupy your thoughts, keep you distracted, so that this affects you less. Pain, again, you can't think your way out of pain, but pain is in it's signals that get sent to your brain, and there's areas of your brain that modify or modulate the pain signal. Anxiety and distress, these are emotions that tend to amplify pain because pain becomes more distressing when it has a certain meaning, a threatening kind of meaning attached to it. So if you're having worries that are, about whether you're fearing that pain means something life-threatening, like your cancer is spreading, or that it's you're having some kind of catastrophe, you're going to be experience that pain much more sharply. So having these different techniques, so whether that's the progressive muscle relaxation, mindfulness, meditation, cognitive diffusion, engaging in some kind of psychotherapy with a professional, these are ways to help you manage those the signal a bit, and also to help you find ways to keep your pain from limiting your life. And so that's often what we can do without using medications for pain. Insomnia, I mentioned some of the issue with the naps. So sleep hygiene, these are like the tips, don't drink coffee after a certain time. Try to have a bedtime routine, those sort of things. That goes hand in hand with something called sleep restriction, which on the face of it seems counterintuitive. So the idea behind sleep restriction is you want to improve a number known as sleep efficiency, which is just the percentage of time that you're asleep when you're actually in bed. And you want that number to be at least 80%. And so often when people have insomnia, what happens is they're laying in bed trying to sleep, tossing and turning. And the more time you spend in bed not sleeping and worrying about not being able to sleep, getting frustrated about not being able to sleep, your brain and your body start to associate being tense, anxious, frustrated with being in bed. And then that's not conducive to sleeping. And so what you want to try to do is retrain yourself to associate being in bed with being asleep. And so that means if you're tossing and turning for 15 minutes or so, get out of bed, wait until you're sleepy, and then get back in bed. That does mean that for some period of time, possibly a few weeks, you're going to sleep less. But over that period of time, you're going to retrain your association with being in bed and being asleep so that you can start going to bed earlier and earlier. This is often most effective when you're doing a program called the cognitive behavioral therapy for insomnia. This can be done with a therapist. It can be done, you can buy these programs online. For example, if you type in CBT for insomnia, that's actually a site that sells a program. And there are a lot of these programs. What it is a whole system basically that helps you use these techniques, whether sleep restriction and other techniques to improve your sleep. And CBT for insomnia is actually, for chronic insomnia, the most effective treatment. It's more effective than any medication for insomnia. And we consider it the gold standard treatment nowadays for chronic insomnia. Other ways of coping, so increasing physical activity. This is often goes hand in hand when we're trying to treat depression. And physical activity, it does release endorphins, dopamine, and those are neurotransmitter that are involved in mood. And so in a way, that's kind of like a weak, or I don't know if I'd say weak, but a form of an antidepressant. It doesn't mean that people never need antidepressants, but even when we have people taking antidepressants, we are encouraging some form of increased physical activity, a concept we call behavioral activation, because we do know that motion or movement does help mood. And so the Live Strong program, and some of you may know about this, it's a free program, 12 weeks at a certain YMCAs, and you can look at it online. Right now, because of course, COVID, they don't have those in-person programs, but they do have online programs. So it's like instructions, it has videos. It's a way to kind of engage in a form of fitness activity while you're at home. and then, of course, the social support is so important. And you know this better than anybody, being in the prostate cancer support group. But what we know about stress is that so physiological stress increases with social isolation and decreases with social connectedness. And so it is something that has profound impact on people, not just for emotional health, but physical health as well. And so there are nowadays a lot of online support groups. Cancer.net lists a lot of them. And I'm sure you all are finding ways to stay connected and support each other despite not being able to be physically near each other. So I mentioned this at the beginning, and so sources of meaning. So a lot of times when people are diagnosed with cancer or are told they now have a life-limiting prognosis or life-limited prognosis, whatever the time period is, whether it's weeks, months, years, sometimes people experience a profound loss of meaning and this sense that, well, what's the point? I'm going to die. What's the point of doing any of this anymore? Now, meaning is inherent to life. As human beings, we search for meaning throughout our lifetimes. And when we feel like we've lost meaning, we haven't actually lost it. We've just become disconnected from it. So there is a form of psychotherapy called meaning-centered psychotherapy, developed by William Breitbart, who's a psychiatrist. He's the chief of psychiatry at Memorial Sloan Kettering. And he says it's like if you can't find your keys, it doesn't mean that your keys have disappeared. It's just that you don't know where they are. You've lost them. But you can look for them, you can find them again. And then even if your keys are gone, they're completely destroyed, you can have new keys made. You can find new sources of meaning. So so this is based on the work of Viktor Frankl, who wrote the book Man's Search for Meaning. He was a psychiatrist who his whole family was killed in the Holocaust. He was the only survivor. And you can imagine somebody in that situation experiencing a loss of meaning, but he actually found a great deal of meaning. He stayed connected to a sense of meaning, and he developed a lot of these concepts that now we recognize as sources of meaning. So he identified various sources of meaning: creative sources, experiential, attitudinal, and legacy. And when we go through life, often we don't think about having these sources of meaning. For example, I don't wake up and say, I'm going to go to work because that's my creative sense of meaning. And then I feel this rush of meaning. That's not really what we experience. We just do these things. We feel this sense of meaning. But sometimes we can feel disconnected from it. And so sometimes in those situations, it's helpful to know, okay, well, these are the types of meaning that we as humans experience. What do I still have? What am I still connected to? What have I lost connection to? And how can I reconnect with that? So, for example, a woman I met who was diagnosed with multiple myeloma and wasn't able to, she was a fitness instructor, and she was no longer able to do that work, but instead she started a organization for fitness for cancer patients with cancer. So as a local organization. So, she lost the work, but she kind of regained it, reconnected with it, and kind of was able to experience that sense of meaning. And in fact, she says she feels as if she has much more meaning now in her in her work, in her purpose than she used to. If you're interested, you can look up, it's called meaning-centered psychotherapy, and learn more about that. So I want to talk about when to look for professional help and seek that out, because as the next couple slides, this slide illustrates, depression and anxiety are both very common in prostate cancer. You look at these numbers, it's more or less 1 in 5, 1 in 6 people experience it at some stage of their cancer journey. Depression, similar pre and post. Anxiety, usually more prominent prior to treatment. Any kind of psychological, social issue, 30 to 50% of prostate cancer patients. So a lot of reasons for this. And I'm sure, especially those of you getting the androgen deprivation treatments, they have a direct effect on your mood. And so even if you're somebody who never suffered from depression or anxiety in the past, this may be something you deal with. And so these are some of the impacts that depression can have when you have prostate cancer. And one of the questions is, well, how do I know that I have clinically significant depression? And generally speaking, it's when your depression, and we think of depression as feeling depressed or feeling sad most of the time, or being unable to enjoy activities anymore. So you do something you normally enjoy doing, and then you just can't feel what you normally would feel. Or being around people that you love and not being able to feel that connection anymore, to the point that it's really affecting your daily functioning. You have no energy, you can't get yourself out of bed, you have no appetite anymore, or you're just unable to sleep and just ruminating, thinking over a lot of negative thoughts, to the point where you can't engage with your life anymore. And it can be accompanied by a sense of hopelessness or even suicidal thoughts. And what we see with depression, often people have less motivation or interest in their treatment. Now, anxiety is actually it's the most common experience following prostate cancer diagnosis and during the prostate cancer. And what we see is almost in the opposite direction. People, especially in the past decade or so, as the recommendations for prostate cancer have been more surveillance or even less testing and less aggressive forms of treatment, living with looking at following your PSA for a very long period of time. People can feel anxious waiting for that other shoe to drop. And it has been found to be a predictor of people moving into active treatment, independent of how their disease is progressing. And so you might think, well, what's the issue with that? And the main issue is sometimes those treatments might carry side effects, morbidity or mortality, because of the treatments. And we want to make sure that when you move on to treatment, that it's because you needed it, and not before because maybe you would never end up needing it. I did want to bring this concept up of the PSA bounce. I don't know if you're all familiar with this, but this is something that has actually been found to be associated with increased survival, but this is a phenomenon that can happen 2 to 3 years after treatment, where the PSA rises and can be associated with a lot of anxiety and this desire to kind of get back into treatment. But actually, it's an indication that things are going well. So when is anxiety significant? When does it need to be treated? When it's getting in the way of your ability to enjoy your life and do the things that you need to do. So worrying so much, feeling so anxious that you're not able to concentrate on your work. You're not able to enjoy time with your friends or family because you're just worrying about your next PSA check or your next scan. So if it gets to that point, you may need some help with that. I do want to talk a little bit about both erectile dysfunction and incontinence, because these are very common experiences. Again, so psychological approaches, not going to fix the issue, the physical issue by itself, but can reduce reduce the impact it has on your life, and two, your psychological state can affect your physical state. So this is an example of how depression can lead to worsening in erectile dysfunction. So if you have a fear of inability to perform, you may withdraw from sexual activity, feel less sense-worth, less masculinity, feel more depressed. And then because you're depressed, you're less intimate, not just in sexual ways, but intimate contact with your loved one, leading to conflict and frustration, leading to more fear of ability to perform sexually. So it's like a vicious cycle. Yes, there is a physical issue, but then the depression, the psychological issue is worsening it. With incontinence, you might see a fear of leaking, leading to a person avoiding social contact, becoming isolated, becoming even more anxious and depressed. And so, yes, you might have leaking, but often, if you imagine you have a friend who has incontinence, you're probably not going to be ridiculing them if they have an accident. You're not going to be ostracizing them. But when it happens to us, we can feel like that is going to happen. And so we want to avoid that from happening. So sometimes it's useful to kind of, as you're having these kind of fears, imagining, well, if this was happening to a friend, what would I advise the friend? What would I want them to do? So again, when to seek help. I have kind of the outline, and it's really about when it is keeping you from doing the things you want to and need to do, or if it's leading to some kind of suicidal thinking. So the National Suicide Prevention Lifeline, it's easy to remember, 800-273-TALK. So I work at Moores. We do have psychiatry and psychosocial services, including medication consultations, psychotherapies, the different health centers, health systems, they have their own programs, and you can just ask your oncologist to help you with the referral. So that's it. I hope this was helpful to you, and feel free to, I forgot to include my contact information, but I can make sure that gets added to the live stream information, and feel free to reach out with questions, and I'll do my best to answer them. So again, I think everybody, there are going to be some things that are important to them, and sometimes what can be helpful is to try to line up with that thing that's important to them. So if it's a hobby that the person used to love, the person with prostate cancer used to love doing, and they're not doing it anymore, kind of bringing that up and saying, well, what about the wood carving? You used to love doing that. I used to love seeing the carvings that you made. What's making it so that you're not interested in doing that anymore? And maybe the person says, well, I'm just too tired. I just don't have the energy to do it. And rather than trying to insist that, well, I think you're depressed and I think you need to see a psychiatrist, I think you need to do something about this depression, that might not be the language that the person connects with. They might just automatically say, well, I'm not depressed. Depression is not something that happens to me. If you just keep it to, okay, well, yeah, fatigue, there are things that the doctors, people can do to help you with the fatigue so that you can be able to do these things that you used to do and love doing. And often it's just one step, and then maybe that leads to a conversation with their oncologist. The oncologist can talk to them about options for fatigue. So that's just one example. And what you want to try to avoid doing is getting into this, I think it's this, and you need to do this, and the person saying, no, I'm not doing that. Like, this is not a problem. I don't know. It's your problem. So you want to speak their language. You want to use the words they use, help identify the things they want, and they're more likely to go along with you if you do that.